Okay, Justin, I just sent Judge Johnson another invite, so he should get that. And then he has more than enough time to join before his part. So let me go live. Tasa, are you guys going live through your software?
I just sent it live.
Okay, because it's not working for us, so I'm going to share yours to our page, but
Okay.
while I do that, media, for all of you that are joining us right now, wanted to let you all know we do have a representative. We have Dan Merrick, the Director of Operations with Foursquare Health. He is going to be representing the Midland Medical Lodge, and he will be speaking after the health department. So we will go in the same order. He'll be going in the middle. And with that, Russell, you can start us off.
Thank you, Erin. Good morning, everyone. I'm Russell Myers, CEO of Midland Health. This is the Unified Command Team briefing for Wednesday, May 13th, 2020. I'll start today by reminding everyone that this is Hospital Week. It's Nurses Week and Hospital Week coincide most years, and this is a really important reminder of how important our healthcare providers are to the health of our community and to all of our overall well-being. And it's a good time of year to stop and remember that. We have had a great outpouring of affection and appreciation from our community through the pandemic efforts, both to our individual healthcare workers here in the hospital and to the system as a whole. And we really appreciate the community support. It's been tremendous. And thank you for all that, especially during this hospital week. A few data points quickly. In the state of Texas, now we are over 41,000 confirmed cases of COVID-19 infection with 1,133 deaths to date. In our hospital today, we have 186 patients. This is as big a census as we've had in quite a while. Our ER volumes are up. We were at 125 yesterday. 10 patients in critical care. 3 of those are on the COVID unit and another 29 patients in our medical surgical COVID unit. So our capacity is being taxed now at a greater extent than it has been since the very beginning of the pandemic. The majority, in fact, all but one of those patients that are COVID positive are from the Midland Medical Lodge. And that's 31 positives from the medical lodge. And so if you factor those out of the equation, the picture looks very different. And we're anxious. We're talking every day to our contacts at the health department and at the medical lodge, anxious to get back to something that looks like normalcy and return those patients who can return to the medical lodge as soon as we can. We know that about a dozen of those, and that number changes day to day, but about a dozen of those patients are asymptomatic, are meeting criteria to return. And so we're just waiting on the green light to move them back to their homes in residence at Midland Medical Lodge and out of the hospital. Looking forward to that. As you all know, I think the governor issued an expectation that all residents and staff in nursing homes across the state would be tested. He assigned the responsibility for that to the Texas Department of State Health Services and others to figure out a plan. As of now, we don't know what that plan is going to be, but we are hopeful of being able to interact with those agencies and give some direction to the plan It feels like a good idea, probably the right thing to do, but we need to very clearly understand what is intended to happen with patients who turn out to be positive, how they're going to be managed within their residencies in the nursing homes, how to, in an orderly fashion, treat those that need to be treated, but assure that the ones that can isolate in place are able to do so. All of those are concerns that are serious ones, and we're going to try to influence that policy making as much as we can. We've also had a good number of calls from the people we serve with regard to loosening the visitation restrictions that we implemented in light of the governor's disaster declaration and regulations from the Health and Human Services Commission that implemented that declaration. As you all know, visitation is severely restricted at the hospital now. We're allowing patients who need someone to speak for them, children or patients who cannot speak for themselves. We allow one visitor or one coach for a laboring patient, and we allow family members to come in when there's a patient who's actively dying. That's about it with regard to allowing visitation now. But there's been an increasing number of people who have asked us to consider allowing one support person for every surgical patient as we've opened up elective surgery. We're trying our best to interpret the regulations that have been issued by HHSC and to see how loose we can make the visitation rules. We haven't made any changes yet, but we're actively considering whether we can agree with those requests from our surgical patients and their families. And over the next few days, we'll make decisions and make those known to the public. But as of now, no changes to visitation policy, but we are actively considering whether we can make some changes. I believe that is it with regard to my remarks, and I'll be happy to take questions before calling on Dr. Wilson to add a little bit.
Let's 1 second to type in the chat. Tasa, do you have any from Facebook that you need to ask?
Yes, yes, Aaron. We have a question from Facebook. Why test them in regards to the nursing home order? Why test them when they are feeling good? Is the governor trying to cause panic?
I can't speak for the governor, as you know. I could speculate on why testing makes sense. I know one of the concerns with regard to the nursing home community is that there are staff members who move from one home to another, and I know that's been one of the active concerns from the beginning, that could be a source of spread. And so if they can determine that there is a positive staff member, they can adequately isolate and track that person's contacts, engage the health department in assuring that they don't spread their positive disease. Beyond that, I don't know. That's a question for the governor and for the Department of Health and Human Services.
I don't have any questions in the chat. So Dr. Wilson, we're good. I mean, Dr. Russell, we're ready for Dr. Wilson.
Yes, he's coming. Thank you.
Thank you, Russell. So I just wanted to make a few other comments. One other comment to what Russell was saying too on the testing that the governor is asking for. One of the points that have been made about this in general across the country is that more testing, more defined disease, the better we can contact trace, the better we can move forward. So I agree with Russell, obviously, that, we can't speak for the governor, but I suspect that the goal is just to try to broaden the testing. And if we're going to broaden the testing with a limited resource of the tests that are available, broadening it in the population that's at highest risk to have problems, it makes a lot of sense. So from my perspective, I endorse what the governor is saying for what that's worth. I'd like to start by saying that hospital, Russell mentioned that we are opening up to more elective procedures. We're in our phase 1 of that process. Things are going extremely well with that. The hospital has been very safe. I think most everyone knows, with some note a few weeks ago, we had one positive healthcare provider, and there's been no others in our facility. The things have stayed very, very good from the standpoint of disease and disease management with the COVID and others here at the hospital. And so things are moving very, very well. We had 32 cases in our operating room, endoscopies open, and other elective procedures are moving forward very well. We anticipate as we move forward and look forward to hearing from the Midland Medical Lodge as we return to their homes, the residents that we have here. We look forward to reducing the volume in our hospital to a point that we can pursue phase two of opening up and getting even more elective procedures and getting people that are waiting for things to get done, to get them done. So we're very excited about that. I'd also like to remind everybody that please, if you do have serious symptoms, that the hospital is a safe place to come to get those things cared for. We had in the last 48 hours on one particular day, we had 3 persons present with heart attacks in a one evening, which rose in the mind of the cardiologist that I spoke to about that people are waiting too long with symptoms before they're coming in. So please be thoughtful about chest pain, shortness of breath, severe abdominal pain, stroke-like symptoms, lateralizing weakness on one side or the other, or slurred speech, or cognitive difficulties that are unusual that a friend or family member notices. These aren't things to be ignored and wait until the COVID disease is no longer in our community. We need to be moving forward and taking care of ourselves and taking care of these diseases as well as we can. So please come to the hospital or call 68 nurse if you have concerning symptoms, and they can walk you through an algorithm to determine if you do need to be seen by your doctor or by somebody more urgently than that. So please pay attention to real symptoms. Their diseases are not going away just because we're dealing with the COVID pandemic currently. Finally, I want to just remind everybody that it's equally important to all of our health that we get the economy moving forward positively in the face of the ongoing pandemic with the coronavirus. It's just as important that we get the economy working, that we get people back out and doing the things that they need to be doing. But we have to do that with a new sense of normal, not the normal that we had before the coronavirus, but with the normal that incorporates social distancing, that incorporates respect for those that you're around in public by wearing a mask to decrease the likelihood that if you are asymptomatic carrying the virus, you won't spread it to other people. Please remember that over 50% of the people that are infected with this virus may manifest no symptoms ever. Spread it to somebody else that could have a dramatically different course with the disease than you're experiencing. So respecting others by wearing a mask when you're in public places where you can't maintain a 6-foot distance. If you can, please, by all means, take the mask off. I don't find it the most comfortable thing in the world either, but I want to respect those that I'm around by wearing it in those circumstances. Clean surfaces frequently, push buttons on phones, picking up pens, push buttons on elevators. These are all high contact areas. Please be thoughtful about that. If you need to use them, use your elbow if you can. If you can't do that, use your finger and then clean your hands again with antiseptic cleanser or with soap and water. Please remember too that this is just a virus. We all know that it's a virus. It's a respiratory tract virus that we are most familiar with, but it also causes gastrointestinal symptoms. You've heard in the news recently about children that have been infected and having vascular inflammation from it. Adults get vascular inflammation from it as well, strokes, heart-related conditions, etc. So it's a nasty virus, and it can be very, very dangerous, particularly in vulnerable populations and in the elderly. So as we get back to doing things, opening up the economy, getting back to work, getting back to restaurants and doing things, let's please be thoughtful about that and be respectful of those who are around and be careful about what you're touching and who you're touching and how close you are to individuals that you're not familiar with. So with that, I'll close and ask if there's any questions.
I will give them a second to type them out in chat. Media, remember you can use the raise your hand feature as well, and I will unmute you to ask your question. We'll wait until they have any. Tasa, do you have any from Facebook?
I don't have any from Facebook. Thanks, Erin.
Okay, Dr. Wilson, we'll just give.
Thank you.
Oh, Dr. Wilson, we have one for you. The first one comes from the MRT. It says, has the hospital seen any patients present with vascular inflammation?
Yes, the course of the disease in most of the people that get really sick becomes a multi-organ system disease. So we've had people that have passed away with the inflammation in the lungs that you've heard about, the acute respiratory distress syndrome or ARDS, but also with myocarditis and inflammation of the heart leading to cardiopulmonary arrest, et cetera. So the sicker one becomes with this and really it becomes a multi-organ system disorder. Similarly, abdominal pain and diarrhea is related to vascular inflammation in the gastrointestinal tract. So we've seen all of those conditions with it.
Okay, and then the next one is from Scott at CBS 7. Scott,
Hey,
you're good to go.
Hey, Aaron, I meant to raise my hand for Russell. My apologies.
They'll trade out.
Okay. Mayor Scott, go ahead.
Hi, Russell. Good morning. Something that I've run across in the last week is that when the strike force, state strike force came in to help with the lodge a week or two ago, they requested that Midland Memorial do coronavirus tests on both staff and patients, and that MMH turned them down initially. Can you confirm that?
No, that I don't know where you heard that, Scott. I don't believe that's true, but I don't know to what you're referencing. I know that there has been some confusion about the lodge and their company's contract with Medical Center Hospital for routine lab testing. And I know that's come up a couple of times along the way, but I'm not aware of a time when we refused to do any testing at the state's request. If you could give me a reference on that, we can check it out.
Okay, can we do that offline?
Sure, yeah, happy to.
All right, great. Thank you.
Is that it for us?
I have, sorry, I have a question from Facebook. If someone gets the virus, do we have enough medication locally to help everyone?
Well, I think there's not a lot of clarity on what medication helps, to tell you the truth. This has evolved a good bit, as I think you all have probably seen. The hydroxychloroquine and zithromycin combination that was promising in the beginning has essentially has fallen out of favor, as it's proven not necessarily to be helpful and to actually have some dangerous side effects. The most common medication we've heard about lately is remdesivir. We have none, and as I think you probably have heard, Gilead's ability to manufacture that in large quantity is not overwhelming at this point, and what they have assigned to the federal government to distribute as they see fit. We understand that some distribution has now happened. We did not get any of that distribution. If the question is specifically about remdesivir, we don't have any. We have a wide variety of other medications and techniques for treating these patients, but that's not one of the things that we can do right now. Okay, thank you.
Thank you, Russell. And now I will turn it over to Whitney Craig with the Health Department.
Good morning. I will start off with a breakdown of our case demographics, and then we will pause for any questions. Our total confirmed cases are 112. For source of exposure, we have 19 that are travel related, 82 that are contact to a known case, 11 that are through community transmission, and 0 that are still under investigation for exposure. For gender, we have 40 that are male and 72 that are female. In our age groups, we have 12 that are 0 to 19, 21 that are 20 to 29, 11 that are 30 to 39, 10 that are 40 to 49, 13 that are 50 to 59, that are 60 to 69, 16 that are 70 to 79, and 22 that are 80 or above. For our patient status, we have 33 cases that are in the hospital, 1 that is in a nursing or rehab facility, 27 that are home isolation, 0 as completed isolation, 39 as recovered, and 12 deceased. For medical visits, we have 32 that were tested at the drive-through, 18 through a clinic or private provider, 12 through the emergency room, 19 as inpatients, and 31 at a congregate facility. As far as the investigation status, 83 are ongoing and 29 are complete. Are there any questions about that?
Okay, the first question comes from the hospital's Facebook. It says, from an outsider's view, it seems that Midland isn't doing a great job with contact tracing and public contact advisories. Is Midland using a different system than other communities?
As far as that question, I'm not sure how they're gauging how well we're doing with contact tracing. As far as the health department, we are doing very well. We have made contact with over 557 individuals for contact tracing. We are currently looking at systems to do this, or currently we're just doing it internally, but there is a national system that's being used. We just seen a demo for that, but the state DSHS, the Texas State Department of Health Services, has a contact tracing system that they are currently working on. It's still in the infancy stages, so we may be moving to that or the other one previously mentioned, but we're doing pretty well with our contact tracing.
And the next question is, are any of the source of contact to new known cases related to the lodge?
I'm
So I
not
think
sure
they're
what
asking
question's
if they're not listed as a
The
resident
contact to known
employee
cases,
at the lodge.
it breaks down. Yeah, the contact to known case category under source of exposure it does include the residents as well as the staff members at Midland Medical Lodge.
The next question is the rapid response team still at MML? How has the department been working with the rapid response team?
Yes, the rapid response team is still on site. They're currently helping with staffing. They stay in contact with the health department to make sure that we are aware of any steps they've taken. And if there's anything that they would recommend, they would make sure that it isn't contrary to any of our recommendations.
The next question is, Ector County says they have contacted over 1,000 people through contact tracing. With Midland County having more cases, why is Midland County contacting less people?
Well, most of our cases are in one congregate location, so their contacts would only be counted one. So therefore, most of our cases aren't going to have as many cases as, say, somebody that is associated with the lodge, because we are only counting the contact as one individual, not each for each case we have, if that makes sense.
I think so. Okay, we'll give them just one more second to see if they have any others. Okay, and oh wait, here's one. Why did the health department wait until May 5th to establish a quarantine of property order? Can you explain what this order actually does?
So the order was put in place due to ongoing. Do you still want me to answer that?
Oh, Mitch, are you saying you want MML to answer that question, or you want the health department? I think he's saying, okay, the health department.
So the order was put in place due to the ongoing positive cases that had previously tested negative. So we just wanted to make sure that we could establish an order so that we could eventually ask for the additional help, which we did, which came in the form of the rapid response force, the task force, as well as different epidemiologists from DSHS, which is the Texas Department of State Health Services. In regards to what the order is doing, the objective is to put a stop to the continued spread of COVID within the negative residents. It's just essentially a tool to help get the lodge to where they need to be, and a unified effort. You know, we're working with the state, we're working with the lodge, working with the hospital, health department. We're all on the same team. We all want the same results. We all have the same objectives. So this is just essentially putting it in writing.
Okay. And with that, we will turn it over to Dan with Foursquare Health representing Midland Medical Lodge.
Thank you, Erin.
And give us any update, or did you just want to?
At Midland Medical Lodge, we continue to work directly with the Midland Health Department, Health and Human Services Commission, and the Midland Memorial Hospital as we progress through the process of mitigating the virus spread at the lodge. We are immensely grateful to our residents' families and the community for their unwavering support of our staff at Midland Medical Lodge. Our staff has been working around the clock to care for our residents, and we appreciate their willingness to go the extra mile during this difficult time. I would also like to personally thank Midland Memorial Hospital for all they have done, including accepting our COVID positive residents. Mr. Myers, Dr. Wilson, and their staff have gone above and beyond to help us during this time. As you know, Midland Medical Lodge serves the most at-risk population. Midland Medical Lodge is truly an example of why the nation and the state of Texas is taking COVID-19 virus so seriously. With that, I'd like to give you some current census data or information at the lodge currently. Today we have 37 residents in-house, 8 of which are on our COVID wing. All are stable at the present moment in time. And we have 31 residents at Midland Memorial Hospital. Thank you.
The first question we have, Dan, is why didn't Foursquare hire a cleaning company to disinfect the nursing home earlier in April? Because it wasn't apparent what was in place was not working.
We continue to clean the facility exactly how we've done in the past. We've learned some things through this process, as all nursing homes have learned, and we'll continue to strive to meet those new requirements or new expectations of our facility and the cleaning processes of the Midland Medical Lodge.
Okay. And now we have a question from CBS 7, Scott Pickey.
Hey, Dan, good morning. Thanks for taking our questions this morning. I have to argue that that you have family support. The family members that we've talked to are angry. They're angry that it took so long to figure out what was going on. They're angry that it took so long to get them to the hospital. They're angry that it took so long to do some testing. One family member says because testing was delayed, they lost a family member. Why did it take the task force coming in and suggesting to you to move everyone to the hospital? Why didn't the lodge take that proactive step days and weeks before, knowing that you had so many people testing positive on a daily basis?
I don't want to get in an argument of progression of events. I know you've heard there are some negative responses or comments about how things have been handled at Midland Medical Lodge, but the overwhelming support of our families has been supportive. They understand what we're dealing with, and we appreciate that. The testing part of everything. Well, let me speak to the moving of the residents. At the time where there was word of the quarantine order with the health department, again, we worked directly with the health department and Midland Memorial Hospital through this process. Midland Medical Lodge activated its disaster preparedness plan in light of calling the rapid response team. We activated the discharge process or transfer of our residents to the hospital, and we also were the ones who called the rapid response team on site, because that's a mechanism that we have at our disposal when we're unable to mitigate the spread in the facility with our personnel.
And I don't want to argue either, but facts are facts. And you can argue facts. But there was a time in there where you were losing people, and it was obvious that there was an issue in the building. And it was obvious, at least from the outside looking in, that quarantining these people in that building wasn't enough. That obviously air was transferring, or people were transferring the virus from one to another. We had 3 more test positive yesterday. The building is still not safe. So what are you doing proactively to lock this virus down, to make sure no one else, say after today, becomes positive with this virus?
Again, we're working hand in hand with the local health department and the rapid response team Health and Human Services Commission have surveyors on site watching and monitoring. We are in the processes of mitigating the spread, and we're working and following the recommendations of the local health department.
And Dan, what does that look like? What does that working and mitigating look like?
The facility's been terminally cleaned by the rapid response team. We have a baseline now. Our housekeeping staff are maintaining that baseline with ongoing monitoring. We have RNs and respiratory therapists in the facility monitoring residents' conditions, and we also have ongoing teaching and training with return demonstration of competency with the rapid response team, the state epidemiologist.
And finally, some 80% of the folks that have died in Midland County have been from the lodge. What do you tell those families who have lost loved ones in that facility when no other facility in our viewing area has had this issue? What do you tell those families who have lost loved ones who entrusted them to you there at the lodge?
My heart goes out to them, and we sincerely are sorry for their loss.
That's it.
Yes, sir.
Okay, thank you. That's all I have.
The last question we have for you, Dan, is can you explain how COVID-19 patients that were originally being kept at the lodge were not properly isolated?
We did take an active role, an active approach in isolating those patients. So that's not correct. We actually did isolate patients. We engineered a COVID wing, and that's where those patients were placed on our 200 hall wing.
And then this will be the last one, and then we'll move on because we've got 3 other people to get to. The MRT asks, is there any grief counseling being offered to residents and staff after losing loved ones?
Yes, through our social services program and psychologist program, we have that service available.
Thank you. And with that, we will turn it over to Orlando at the school district.
Thank you, Erin, and welcome back to everyone. Want to present Midland ISD's May 13th update. I want to begin by saying I would ask all those who are listening and viewing if they would please pray for the family of our employee who was tragically killed yesterday. A horrific event, and those prayers that those families need at this moment, knowing everything that we're going through in our community, state, and country, to take that on as well is that family's going to need a big lift. So if you'd please take a moment today to do that. I want to also begin by today thanking so many individuals who've stepped up during this time. It's been an unparalleled time that we've ventured into. I want to thank all of our teachers and our staff and our families as we get close to approaching the end of the academic year. I'm keenly aware of the sacrifices that people have made through this entire learning continuum, from the early mornings to the late evenings, because of the professional status that some of our members have in our community with work, some of those frontline employees that are out there as well, and those who are able to afford the opportunity to be home with their kids. It's still a challenge that we have been working through. Our teachers who've set up over 1,000 Google Classrooms to establish a virtual learning space available to students 24 hours a day is uniquely different than what we were doing previously. And want to certainly thank our teachers, our nurses who have worked tirelessly to not only support the hospital and our community, but our schools and families as well. Our CNS workers who are keeping thousands and thousands of kids fed daily and have fed over 350,000 meals during this time, and being on the front line to support families during these weeks and months that we've been navigating. And then our custodial maintenance crews who have continually cleaned, disinfected, and sanitized our buildings. These are individuals who are in our system who many times are do not get a lot of the gratitude for the work that they do. But rest assured, if they were not doing this work, we would certainly be suffering as a school community. So I appreciate the fact that they've stepped up and have launched this work and engaged our community and our students and our families hand in hand around this. Last but not certainly least, I want to thank, again, our parents, grandparents, aunts and uncles, sisters and brothers, all those individuals who stepped up to resume the role of teacher. Highly unusual in many cases. Some of you were natural in regards to that. And I would share that if you felt that there was a fluid, natural aspect to it, you have certainly missed your calling. And I would certainly say that we would welcome you to the brotherhood and sisterhood of education, knowing what you've done and what you've spearheaded. We know that parents and parent supporters are the first and are first and foremost your child's first teacher. And we want to thank you for the work that you've done. We're not over yet. We have a week and 2 days to get to. Press hard around what that looks like. We're going to be getting into course completion. And so we want you to not only take to the end of this week, but to next week in a very strong aspect. There'll be communication that will be coming home or going out via phone in regards to progress reporting, so that you can understand and know where your child is at this stage in regards to with a week and 2 days left in the school year. And so if you have an opportunity, if you go into our Skyward Family Access, review your students' progress report information. If you've not done that as of today, please go in and take care of that. It's a simple process, gives you all the information that you know in regards to where your child is, in regards to performing and being on track, or not performing and being off track, so that you can then have a conversation with teacher and campus principal, assistant principal, counselor in regards to where your child is. We're here to help and build what this looks like. And we want to make sure parents are readily assessing the information and accessing how to do that. With that, I'll take questions.
We'll give them just a little bit to see if they have any. All right, Orlando, thank you.
All right, thank you, Aaron.
With that, we will move over to Judge Johnson.
Okay, good morning. I want to start out by talking about chat. Right now, we kind of hit a landmark that I was hoping for. We got over 100 or over 1,000 subscribers. The average number of those folks are reporting symptoms today are 3.2%. We saw just a very small spike last week, and we attribute it to the allergies that the doctors were reporting. It's leveled off. One of the benefits of chat is when you're prompted to answer, if you answer no, you're reminded of the best practices that you hear at meetings like this. And if you answer yes, then you're directed to call 6-8 nurse and to stay safe. So I've had a few people this week say they thought they had a symptom. What do they do? So this is just a way of reminding you, call 6-8 nurse. Once I say that, they go, oh yeah, they remember. So this is just a way of keeping that at the forefront. So what we'd like to do is remind all the residents to continue taking responsibility for yourself and take responsibility for your neighbor. We've had just a few county employees who've been tested. They've all tested negative. So very appreciative of that, very proud of that. Today we'll be going through the courthouse with the health department to look over the measures we put in place so that we can open back up to keep everybody safe. The one concern we have is the courts. Right now there are no jury trials going on because of the mere fact of bringing in hundreds of people to pick juries from. So we're slowly working through that process. The state has requirements, and as we meet those and as the deadlines for their requirements come into play, then we will start seeing jury trials again. Second topic I want to talk about is the Buy Midland, Build Midland. I want to thank the Commissioners Court for adopting that Buy Midland, Build Midland initiative resolution last Monday. The resolution instructs all county departments to evaluate any upcoming purchases to ensure that we're buying local whenever we can. We recently identified a pending purchase. It's going to be well over $150,000. And we're putting that out for rebid locally so that hopefully, if awarded locally, that money can stay here in Midland. As we know, any money that we spend in Midland, or any community for that matter, produces an economic impact of 7 times. And in this particular case, that's over $1 million worth of circulation back into the Midland economy. This is something I think is the beginning of things we can do to help stimulate our economy as we come out of this. I hope all taxing entities and all local businesses will put this into practice whenever possible. We made it very much simpler to get into our bidding lists. And one of the improvements we did is we took our 12-page bidder application packet and we condensed it down to 2 pages so that it's not so intimidating. Therefore, it makes local folks, makes it easier for them to fill it out and get it back to us. We'll be making sure that all local vendors are aware of what our needs are. We'll be using all the social media we can and a lot of other means. Hope to start a program next week, I hope, to just start getting the word out there and let folks know and be a part of it. And that's about all I have today.
Okay, we'll give them just a few seconds to see if they have any questions. Remember, you can raise your hand or type it in the chat. All right, Judge Johnson, thank you.
Thank you.
Mayor Payton, we're ready for you.
All right, thank you. And good morning to everybody. It's not afternoon just yet. I want to start off with just a word of thanks to a number of people. I want to just express my thanks to Midland Medical Lodge for being willing to be on our Zoom session today. That's a stand-up action to be willing to take the questions, even in the midst of the heat and the concern of our residents and our media and so forth. So thank you for doing that. Also, just thankful to all the leaders and all the organizations that have been on this call and people that are in the ring, as we all are, but people that are serving and taking these positions on the front lines that really nobody could have ever imagined, even if you were trying to write a novel about something crazy. And going all the way back to the beginning of our conversation 42 minutes ago, continued thanks to Midland Health, as well as the health department for the things that they are doing. And then that leads me really to just a thanks again to our residents, to everybody who has been exercising incredible amounts of patience and even restraint as life has been challenged and life has been changed and life has been restricted. Thank you for really just doing a great job of being patient, even though life is very, very difficult. It's one of those rare occasions where you actually run into everybody you run into is in a difficult situation. So hopefully we're beginning to turn the corner into a bit of a new reality. That brings me to a couple of points. As of yesterday, I signed an order to rescind my emergency declaration that we put into place several weeks ago at the beginning of this pandemic here around the country as it reached Midland. Quite frankly, there was no reason for me to have an emergency declaration in place when anything the governor did from here on out was over and above what we were doing. And so it negated the things that we might have in place. And also just continuing to communicate to people that as we follow the phase 1 and phase 2 guidelines set out by the governor, that hopefully we'll be going into phase 2 beginning this coming Monday, the 18th. And with that, opening up some more of the economy per that phase 1 and phase 2. And I'm also very proud to say mirrors very closely what we submitted as West Texas mayors to the governor's office as a process to follow for opening up the economy. we'll be ready to go with the 50% occupancy growth, as well as all businesses being seen as essential businesses. I want to also speak to the issue of this new reality that we're going to be stepping into. I wrote down in my notes, really, it's two new realities we're stepping into. It's a get back to work and get back to life reality. I know all of us, I don't think there are any exceptions except maybe some nervousness, that all of us want to get back to life. All of us want to get back to work. But the second part of that is protecting life and work. And as Dr. Wilson said earlier, he mentioned getting back to a new sense of normal. And I would add to that that it's important for us to remember we're getting back to a new and heightened human responsibility. Probably more than any other time, we've all been reminded of how important it is to wash our hands and to pay attention to where we are and what we're doing to people around us or what they might be doing to us. It's not a new day of fear, but it is a new day of just paying attention once again to human responsibility. Also recognizing that all of us have begun to realize in a new and a fresh way how important being around people is, as we have been isolated in our homes and in different places. We will continue to succeed in this. With the exception of the one serious problem we're having, our numbers are quite literally at a flat line, at a zero in this regard. But if we'll continue to do the right thing, continue to do what makes the free market economy successful, which is quite literally rooted in the ancient scripture of loving your neighbor as yourself and doing good to others, I'm fairly certain that you're not going to go visit places of business that put your health in danger and put the health of others in danger. And any business that is disregarding the mandates from the state will have to deal with those issues as the state looks at their licenses and so forth. There are a few concerns that I have as we move forward. I've just clearly written those down, and that is that we remember, even in the midst of all the different data that shows up, all the different studies that show up that have very little longevity to them, there is something we know for certain, and that is our elderly populations and those who have extenuating health conditions are the ones most susceptible. That has been consistent through this whole ordeal we've been going through. We have to pay attention to that. I want to finally, or pretty close to finally, also just remind everybody how important our public school system is. I'm deeply, deeply concerned about our children that we've lost contact with through no fault of MISD. It just happens to be the dynamic of families. I was in a tragic conversation yesterday with those who work with child protection services, realizing that we have had many, many children disappear and we don't know what's happening to them. We're fairly certain there's a rise in child abuse and child hunger. We need to get back to a new normal, back to life and back to work, and look forward to a new day in our school system that happens to be a refuge for a number of students. And also just being aware that as we continue to hear things from Austin and we continue here in Midland to do what we need to do, it's important you realize as residents that there's still a lot of murkiness sometimes. And I want to encourage you to go to the website, texas.gov, and to keep up with those alerts, as well as keeping up with the City of Midland's alerts. You really need to stay in those areas, as well as probably the CDC website, to get your information, not be depending on the national news networks. And I will conclude by saying once again, as I make mention to the national news networks, I want to commend our media and thank you for all you have continued to do. I have been telling people over and over again that though I've grown quite disillusioned with the national media, our media sources here have been doing a tremendous job of getting you information, getting pertinent information, accurate information. And so I say thank you once again to our media partners for your questions and for your consistency. And with that, I'll be happy to take some questions, Aaron.
Okay, let me give them a little bit to type them out and we'll see if anyone raises their hand. The MRT asks, are you concerned about businesses increasing to 50% capacity next week as the number of confirmed cases continues to rise?
I'm not concerned at all because the number of confirmed cases is not something related to our economy opening up. The number of confirmed cases is really due to the issue we're dealing with that we've already had quite a conversation with on this call. I'm more encouraged by the fact that we have not had a large increase or really much increase at all that isn't connected to the issue we've been dealing with. And so I'm very confident with what our businesses are doing and what they will continue to do. And even driving around and even going into these places of business, seeing the things they're doing to protect our residents. So I have very little concern about it other than the general anxiety of wondering if we'll see an uptick because we continue to grow our economy back to where it needs to be, but we'll continue to watch that.
Has the city received any complaints of businesses operating above allowed capacity? And have any warning or citations been issued regarding this?
We have received concerned citizen reports, but we have not issued any citations. And for the most part, we've gotten response from the city that they're appreciating what our businesses are doing. And quite frankly, many times concerned citizens and residents are actually telling the businesses they're concerned. And that's really the most effective citation we have, is that if customers continue to think that their safety is in danger, that they will take their business to other places.
Okay. Let me see if we have any more media questions. I know News West 9 has a question for Orlando. Orlando, are you still on? Could you answer one question for us?
Yep, go ahead.
Tate, you want to go ahead and ask your question?
Oh, I just sent it in the chat. Sorry. Okay, I'll just read it. Mr. Riddick, the TEA is, I saw where they were suggesting intersessional calendars for next year,
Correct.
that include earlier start dates, etc. So I was wondering if MISD is, considering doing something with that suggestion, or if y'all started working on, a different calendar next year to kind of prevent those disruptions.
Yeah, so thank you for that, Tate. And so part of the intersessional calendar, or the calendar that, year round, whatever we may reference it to, speaks to probably every 9 weeks, there's a 2-week break. Because we know that at this point, there are going to be what I term micro closures, where schools will close because of a staff or a student or a family member connected to one or the other, that we may have to close a school down for a duration of time. Let's call it 14 days. And so with that, we know that we've got to develop or think about a calendar that works that way. So a few board meetings ago, when we were presenting our traditional calendar, we brought to the community as well what a year-round calendar could look like that would have these very components built in before we got days this entire COVID-19 scenario around what school could look like. So we are going to bring back to the board information, not only from the agency, but things that we have been exploring and thinking about over a number of years for me in regards to what our board could do. It does talk about on a different calendar timeline. It does have a July start date. You still get the same holidays and things off, but you get an increased time during the holiday break, as well as other times that offset what that could look like for teacher contract number of days, as well as for student days. And then you get your 6 weeks off in the summer is what it amounts to. So it's something that, we're looking at, and something that we'll continue to bring information to our board to see if that's something that we want to expose. Right now, we have a traditional calendar that's been authorized for 2021. And we'll see how soon, if we do get this opportunity to think about an intersessional calendar or year-round calendar, what that could look like. There are many members of our community who did want to go down that pathway, and there were some who said that they wanted to keep the traditional calendar dates. So we'll start next week with information to our board to see where we may progress.
Okay, great. And then just a quick little follow-up to that.
Yep.
I see where the TEA said some of the benefits of it, changing the calendar. But, here locally, how would that benefit the district or the students in the district?
So when you think about time, I think that's one of the elements that after 9 weeks, you get this 2-week break. So that affords not only family and students the time to refresh and get started again, but that 2-week break, you can actually use the first week as a type of recovery time For students who are still lagging in concepts academically, you can bring them in for that first week, half day, let's say from 8 to 12, so that they're able to gain more exposure in the work and then have the following week off. So it helps not only a student who's driving quickly and fast to get that break time, it helps us allow that student who needs recovery time, what that could look like on their academics standpoint. And then it puts that out periodically through the year so that students are able to maneuver in and out of what that could look like for their learning. So I think it's an opportunity for us to really do something that meets where we're headed with what we're doing academically and with our classroom setting currently right now. So Core ISD is a perfect example. They've been doing this for over a decade with this type of calendar. People then called it year-round calendar. That's how it was initially introduced from the agency. Now it's called an intersessional calendar. But it's a calendar that really benefits what helps kids in a community with time.
Okay, great. Thank you very much. Thank you.
You're welcome.
Thank you, Orlando. Mayor Payton, I didn't have any additional questions for you. So with that, we will conclude our Unified Command Team press conference. Thank you, everyone, for joining us today.
Thank you. Have a good day.
Bye.